Good afternoon.
Good afternoon.
This is Rusha, the nurse assigned for you now. May I know the reason for your visit in this emergency department?
I'm being bitten on my hand by a dog.
I'm sorry to hear that. Before going ahead, what shall I call you?
I'm Albert.
Okay, thank you, Mr. Albert. I can see the wound on your hand. Is it okay if I ask you a few questions about dog bite?
Of course, you can proceed.
Alright, thank you, Mr. Albert. So when did the dog bite happen?
I was bitten about an hour ago by my neighbor's dog.
Okay. Alright, so how severe the wound is?
It broke my skin in several places.
Mm-hmm.
I think the wound is so deep because it bled heavily.
Okay. Sorry, Mr. Albert. I have few more questions about the care you have given to the wound. May I ask?
It's alright, you can ask me.
Alright. So did you clean or dress your wound?
No, I did not try to clean the wound as it was bleeding too much.
Okay.
I covered it with a sterile pad and applied pressure.
Mm-hmm. So have you applied any antiseptic cream?
No, I haven't tried any cream.
Okay. So did you take any painkiller or pain relief by yourself?
Yeah, I have taken 2 paracetamol tablets just after it happened, but it is still very painful.
Mm-hmm. I appreciate, Mr. Albert, that you answered all my questions despite of being in this difficult situation. So I'll be telling you a few ways to manage your wound. So the next step is to clean and assess your wound. After that, the wound will be examined by the doctor. Is it okay, Mr. Albert?
Yeah, it's quite sensible.
Alright, so thereafter we will have your blood tests to be done and then you will be checked whether to rule out any infections. You will probably need an X-ray in order to find out if there is any bone or tendon damage. Immediately after the test and the examination, the doctor will prescribe you appropriate antibiotic and pain relief. Okay, Mr. Albert?
Yeah, that's quite fine.
I hope you are following me.
Yes.
It is also equally important to take a tetanus booster as it is an animal bite. So, Mr. Albert, I hope what I have told you is clear.
Yes, nurse.
Okay. So, do you have any other questions for me?
Yes. I can't remember when I last had the tetanus booster.
Mm-hmm.
So it is perhaps a good idea to have one now.
Okay.
My question is, how many stitches will I need?
Alright. So, Mr. Albert, don't be apprehensive about it. According to the current recommendation, animal bites do not need any stitches. So the wound is easier to clean and there is very less risk of infection. It will be reviewed after a few days to ensure healing process. After the examination, your doctor will confirm the requirement of the treatment for the wound. So there is nothing to be worried about. Okay, Mr. Albert?
Yes.
So Mr. Albert, do you have any further queries to ask me?
No, I am glad that I don't need stitches. I shall just wait to see the doctor now.
Okay, that is fine, Mr. Albert. And I'm here for you and you can press the buzzer if there is any kind of assistance required.
Sure.
Thank you, Mr. Albert.
You are welcome.